Well, early on, as far as the diabetes center goes, that's who I work for ultimately at St. Vincent Healthcare, and they have been in place to help treat diabetes. And when this opportunity came up, they seized the moment because we've known that type 2 diabetes is largely preventable through lifestyle. And so how exciting to know that we could continue out our program and have a diabetes prevention program as well as help people with diabetes treatments. A lot of the focus from the nutrition standpoint is reducing fat in the diet. And the reason we try to reduce fat intake is that fat is the most dense source of calories. And so if we can reduce fat, we often can reduce calories, and then it helps us create the calorie deficit we need to lose weight. And of course you combine that with the increased physical activity as well. But we put that in the context of a healthy diet. So we're trying to reduce fat intake, but we're also looking at what a healthy diet looks like and portion sizes. A lot of the things that we do too are behavioral, because ultimately we're trying to change habits. And that's really what sets programs like the Diabetes Prevention Program apart from a lot of programs, is that it's very behavior-based. We use a national curriculum that's very well researched, and it takes components of behavior change and puts them into this curriculum. And so we're not only giving people knowledge, but we're giving them tools and support that they need to change habits. One of the most important aspects of participating in the diabetes prevention program is keeping a food diary, and we call that keeping track. People are able to do that either in this handwritten format or also online methods. So I give them some tools to use. Some people with smartphones really like doing the online method. And we know from research that keeping a food diary is a very important part of behavior change. Sometimes, depending on people's backgrounds, they may or may not have been exposed to many foods as a young person. And sometimes those early exposures help us establish our tastes. But we definitely encourage people to try new things. Certainly trying to get people to include more fruits and vegetables. We do some tasting in class, and the group setting actually is very encouraging and supportive for that, because you get the diversity of the group. So you have somebody that say, gee, I tried this week and boy, it was good. I'd never had that before, and then that encourages other people to try it as well. When people learn about our program and say, that's something I'm interested in, they typically will call the office, and then I will visit with them about what the eligibility criteria is. And if it's something they'd like to pursue, then I would send them an enrollment or a referral form. And then it's up to them to go to their personal physician and get that referral. And what we like to see on a referral is labs within 6 months, and also height and weight, and a couple other medical suitability criteria.